You may have gotten data breach notifications in the mail, whether it's from a hospital, your pharmacy, or some company you've never heard of.
Healthcare providers are still dealing with the cyber attack on Change Healthcare.
Change Healthcare.
Change Healthcare says the data breach is on the dark web now.
According to the FBI, the healthcare industry has the most ransomware attacks of any industry sector. But why is healthcare cybersecurity so bad? I've talked to a lot of experts about this, and a lot of this goes back to 2009 when the US government mandated the healthcare systems to make patient records electronic, but didn't put enough regulations in place to protect those electronic records. Basically, we made everything electronic without being prepared to protect that electronic information. But we have HIPAA, right?
You may know about a law known as the Health Insurance Portability and Accountability Act. We're serious about working with you to protect your health information. Know your rights.
That law is famously all about keeping your health records private. So shouldn't hospitals and doctors' offices have to abide by HIPAA and keep your data safe from hackers? In some ways, yes. HIPAA requires healthcare organizations with data breaches to publicly report them and will fine them if they don't have the right controls in place. But it doesn't mandate hospitals and other businesses to protect their patients from cyber attacks. How are those things different? Let me explain. You see, HIPAA is all about breaches of data privacy. Because the laws only have monetary penalties for the breaches themselves, there's no incentive to spend money to make sure that a hospital's networks are segregated so that if hackers get in, the damage is minimized. Planning for how a hospital is going to run for weeks on end without computers is not part of the cyber budget. And having more than one vendor for if your third-party middleman services go out is really expensive.
If I'm a CIO in a healthcare organization, I have 10 things I need to do, and 5 of them are regulated, they're getting all my attention. I'm not necessarily pro-regulation. I'm just saying we need to get everybody to move and to understand the gravity of this.
When a healthcare organization has its network hacked and held for ransom, everything that is needed to run the hospital, pharmacy orders, labs, scheduling, insurance verification, sometimes even the email and phone systems are just gone, and that impacts patient care. For example, the University of Vermont Medical Center had a cyber attack on October 28, 2020.
The commissioner says this appears to be the worst one we've seen.
The system's chief information officer, Nate Cooter, said that even though they figured out what was happening within days, it took months for them to put all the systems back online.
It's dangerous to allow the clinician to have right access to the EMR because there is going to be expected things that should happen. When I put this order in, it should trigger these things. And if those things don't happen as expected, it's dangerous to the patient.
And this isn't just a problem when hospitals are attacked. Because so many things have gone digital, hospitals hire middlemen to handle all that data, and they're vulnerable to cyber attacks too. And because they handle the business and information of so many different hospitals, doctors' offices, and pharmacies, when they go down, it's catastrophic. In February 2024, a company called Change Healthcare got hit with a cyber attack and went offline. Change is a clearinghouse, kind of like a mailman. It sends claims to insurance companies from hospitals, sends the payments from insurance companies back to hospitals and doctors, facilitates the communication between doctors and insurance companies when they need to get a procedure approved, and handles the back and forth between your pharmacy and your insurance company when you're trying to figure out how much you're paying for a prescription. Change is one of the biggest companies doing this, connecting over 2,000 insurers to 1 million doctors, thousands of pharmacies, and thousands of hospitals. So when Change went offline, hospitals, therapists, doctors, dentists couldn't get paid. As of the recording of this video, more than 6 months after the cyber attack, Change still doesn't have all of its systems fully back up yet. Research shows that when computer systems are down because of a cyber attack, patient outcomes are worse. During a cyber attack, patients are more likely to die in that hospital at that time than at any other time. Facilities under attack may have to refuse patients, forcing ambulances to take patients to hospitals further away. This also increases the number of patients in nearby emergency rooms and increases the likelihood that patients leave without being seen. This is particularly a problem in rural areas where there aren't other hospitals nearby to pick up the slack. And there's evidence that cyber attacks weaken already struggling hospitals and nursing homes, leaving them without a way to get paid for their services and forcing them to close. That happened in 2023 with St. Margaret's Health, a hospital in Spring Valley, Illinois.
Due to a number of factors, such as the COVID-19 pandemic, the cyber attack on the computer system of St. Margaret's Health, and a shortage of staff, it has become impossible to sustain our ministry.
While organizations like the American Hospital Association have told Congress that they oppose mandatory cybersecurity requirements, other experts say that more regulation is the only way to get healthcare organizations, both hospitals and third parties like Change, to adhere to basic levels of cybersecurity measures. The U.S. Department of Health and Human Services has promised that later this year they will update rules and cybersecurity minimums for healthcare. But the thought in everyone's mind, including the government's, is where the money for all of this is going to come from.
We're moving from this voluntary world to one where they are requirements, and we're lifting all boats in the sector. And we need Congress to help us with the dollars to do that. It's not a small task. It's not an inexpensive task. And so Congress providing CMS with these authorities and the dollars to get the sector able to invest in this is, I think, another important piece of this.
But finding the right policies and the money to pay for them is tricky, and only time will tell whether healthcare can turn things around. Until then, expect more of these guys in the mail.